Good evening to everyone and welcome to today's session. Can you please punch whether the voice is loud and clear? Roshan, Ranjan and Riazu and many more. Yes, it's a very harsh summer afternoon with 44 degrees in Hyderabad. So we started little late so that the tradition, the tradition of taking a test, having a discussion on every Sunday should go on until the January. So that is the whole idea. So let us make the great beginning, doctor. Perioperative antibiotic therapy for the gangrenous appendicitis. It is directed against both gram-negative aerobes and anaerobes, and until the resolution of the leukocytosis. Until then, you need to continue. Oh, Rajan says, cool climate in Kathmandu. Sure. Invite me, I'll come down. This summer is very tough. A 1.5 centimeter carcinoid tumor located at the base of the appendix. How do you want to treat it, doc? Right hemicolectomy always. It is not just the appendicectomy, but the size of the carcinoid mandates you to do the colectomy is what you need to remember. Appendicitis, how is it initiated? Initially a fecolith will go and cause a obstruction, and that is the starting point for the inflammatory process, and appendicitis is what you need to remember. A large appendiceal abscess, what is the best way to manage it? Percutaneous drainage, antibiotics and interval appendectomy. Ochsner-Sherren's regime is something that you should not forget. After appendectomy, what is the most common complication? It is the infection which is the most common complication. A surgeon's negative appendectomy rate when you do a surgical audit should never be higher than 10% to 15% is what you need to remember. In the colon, what is the most abundant species? It is the bacteroides which are most abundant. The short chain fatty acid which is being produced by the colonic organisms, which is used in the cholesterol synthesis, is acetate. All of you know acetate, acetoacetyl-CoA, beta hydroxybutyrate and beta hydroxybutyrate, HMG-CoA. HMG-CoA is a starting point for both ketone bodies and also for the cholesterol synthesis is what you need to basically remember. Keep punching your answers. I go like a tornado, quickly trying to finish as many questions as possible, because Sunday discussion is all about solving the paper and checking how good we are and getting ourselves wake up, identify what areas we want to improve. You have all that content, discussion, everything there in the video library. And Monday to Saturday is the time where we will pick up the concepts, questions and have a more detailed discussion. I hope all of you are okay with me to go like Shatabdi Express. The principal secretory cation in the colon is potassium. The most appropriate management, if you have a diverticulitis with a 3 centimeter pelvic abscess, how do you want to clinically manage? You need to do conservative medical management with perioperative antibiotics, prepare the gut and then do the surgery. If you want to detect a fistula in a given case of diverticulitis in women, what is the best investigation? Any day it is CT scan. You can see this is how the abdominal CT scan shows. Sigmoid diverticulitis, which is having the free air inside it, all these bubbles is what you have to understand. Good to see 28 online students. I try my best from next week to be with you all by 12 p.m. sharp. At least 200 questions we will try to discuss. That is a whole idea, right? So I will also give you the link with which you can enroll for the online test series. You can take the test, all the 300 questions test online, so that you are ready by the time it is 12 o'clock for participating in a discussion. So I'll try to send you the link. You can subscribe to the mock tests. The most common cause for the recurrent diverticulitis after the sigmoid resection, what is that? It is the inadequate distal resection margin is responsible for the recurrent diverticulitis after sigmoid resection. How is internal anal sphincter formed embryologically? Embryologically, what is the source? It is the circular muscle layer of the rectum, which is in extension leads to internal anal sphincter. What is the most common position for the appendix? Hundreds of times this question had been asked in the past. It is retroperitoneal and retrocecal is what you need to remember. Please keep punching the answers, doctor. Don't. So if you are punching the answers, you will. You are in sync with me. I will also be able to know how good you are answering, right? To be able to actively participate in this interactive session online, 9 to 12 you have to give your time to take the online test. Of course, we run a PowerPoint slideshow, but you get all the key explanations, everything in the online test. And out of 300, are you able to score and cross 210 out of 300? Corrects if you are able to answer, you are doing good. Otherwise, you need to identify the areas where you need to improve. That is how the progression should happen. The next 40 weeks time that we have before we go to the NEETPG exam is the most crucial part, like a World Cup. You should be well prepared. So, doc, retroperitoneally and retrocecal. The mid-transverse colon, the main blood supply comes from superior mesenteric artery. So similarly, you must know what is portosystemic anastomosis, how are they formed in anatomy. All those details are very much discussed in anatomy in the high yield topics video library. So please take a chance to review. In the pelvic floor, which is the most important muscle that maintains the rectal angle, you should remember it is the puborectalis running between the tip of the coccyx and the pubic bone is the one which maintains the rectal angle, and accordingly the continence is what you need to understand. Now, emergency contraceptive, which among this you can be able to use? Monophasic contraceptive pill, RU486, copper T intrauterine device, any of them can be able to be used as the emergency contraceptives. JIPMER regime, what is the dose of the levonorgestrel, all those funda, you have to, if you answer this question wrong, you have to really do a great work, doctor. To hold laparoscopic sterilization, tubal occlusion clamp, what are the following places which you like to select? I mean, which location is good for doing that procedure? PHC, nowadays we have electronic police stations, electronic PHCs. So everything has now is becoming Digital India, right? So you must be quite sure. In the RCH, checklist kisko hota hai? Checklist is whenever you are giving monophasic pill, you should have a checklist. What are the contraindications for the estrogen, like DVT, etc.? Are they there? You have to check. One of the endometriosis drug that increases the hepatic enzyme levels and affects the lipid profile of the patient, that is the danazole, is the one. Whenever danazole is being given, liver enzyme monitoring is very, very important. A 60-year-old woman, she has a adnexal mass and nodules in the pouch of Douglas. What is the most likely possibility? Obviously, there is a dissemination of the ovarian tumor into the adnexa. So, it is a malignant ovarian tumor. A bluish suburethral nodule in the 1/3 of the vagina, lower 1/3 of the vagina. What does it suggest? It suggests choriocarcinoma is what you need to remember. So now we use the terms high grade squamous intraepithelial lesion, low grade squamous intraepithelial lesion. If you take the Bethesda system of the pap smear, what is the correlation between these two systems of terminology and nomenclature? You should remember CIN2, CIN3 in Bethesda is equivalent to HGSIL. So CIN2 to 3 is equivalent to HGSIL. If it is CIN2, 40% of them regress, 30% persist, 20% will become CIN3 is what you need to remember. Then CIN3, 33% of them will regress. So that is the importance. Once more, this is a list based question. CA 125. What are all the conditions that cause an increased CA 125 is my question. Endometriosis, dysgerminoma ovary, endometrioid carcinoma of the ovary, anything can cause an increase of the CA 125. ये तो बट्टी मारने वाला लिस्ट है, बट्टी मरना ही पड़ेगा और एग्जाम को जाना. So that is very important, doctor. Inevitable. There are certain 5,000 lists which are inevitable, that you have to take pen and paper. These 5,000 lists आपके दिमाग में बैठ जाना. There is no other way. There are 5,000 reasoning based issues like renal tubular acidosis, Bartter syndrome, Liddle syndrome, etc. There are 10,000 single liners. These 20,000 फटाफट अगर आप मास्टर कर लिए तो you are ready to win any kind of battle of PG medical entrance. Take it as my word. We have seen 20 years. I had been 20 years a classmate to students like you. Every day, every week, preparing along with them. And when they go to the exam, I will be waiting how my horses have performed in the game, how my jockeys have performed in the match. So, doctor, the simple secret is you have to bring out that great man who is living inside you. You have to do the revision. You have to be focused. You should know what to read. That is all. The moment you understood that, you did at least 300 hours of a conscious effort, took every Sunday grand test and every day evening chai pe charcha to get activated and consumed the video library. Nobody is going to stop you from becoming a winner. Gestational trophoblastic neoplasm. What are all included? Which is showing which one do you include? So it is chorioadenoma dehiscence and placental site trophoblastic disease is what you need to basically remember. Polycystic ovarian syndrome may, due to the excess androgen, you have hirsutism. So how do you want to manage? OCPs will help you to manage the hirsutism. After hysterectomy, secondary hemorrhage, typically why does it happen? What is the most often a cause for that? Sepsis. So all types of hysterectomy, complications of hysterectomy, all this story you have to be very sure. In tubal infertility, when you are doing surgical treatment, how do you get the best results? It is by the tubal anastomosis you get the best results of all the procedures, is what you need to remember. Genital TB, sixth most high yielding topic in gynecology and obstetrics. Infertility, carcinoma cervix, carcinoma ovary, carcinoma endometrium, fibroids, cervical prolapse, diabetes in pregnancy, medical disorders of pregnancy, like that. There is a list of 43 topics in gynecology and obstetrics. Garma garam, you have to read it, master it, have 10 points in your pocket on every topic, and then go and face the examiner. So doc, fallopian tubes, endometrium, ovaries followed by cervix is the order in which the genital TB typically involves. Nulliparous female, third degree uterovaginal descent. How do you want to clinically manage? Purandare sling operation, the important keyword is nulliparous female is the one. She wanted to have children in future. So you have to manage her prolapse, at the same time retain her reproductive functionality. In a malaria control program, what is an index of operational efficiency? EBER, annual blood examination rate, is a marker that how your healthcare workers sincerely are going, taking the blood sample, testing the slides. ABER is an important index. What is the extrinsic incubation period of malaria? Between 10 to 14 days. In behavioral sciences, what is the method of management based on the principles of behavioral science? Personal management. So once more, doctor, what is PERT? What is network analysis? What is critical path method, CPM? ये सब चीजें आप मास्टर करना SPM में. Birth and registration, death registration. Event of death should be registered in 7 days. Pseudo carriers, where do you find? In infectious hepatitis. Multi-purpose health worker scheme. Which committee, doctor? Kartar Singh committee. I say question आ क्यों पूछते? Why do they apply filters? Instead of giving 300 clinical cases, dum hai to make a diagnosis based on the clinical vignette and show your knowledge on the treatment protocols. That should be the style of examination and pattern. But unfortunately, Kartar committee क्या है? Female anopheles को squint रहता या it will be dancing, floating on the water. All these questions will be asked. It's very difficult. But sometimes examiner has to use a filter. 150,000 people are competing. Only 20,000 seats. Very sad story called Indian exams. But we have to crack it. There is a way to crack it, easy to crack it, provided you are focused to crack it. That is important, doc. Nosocomial infection. It is an infection acquired in the hospital. In the health education, what is the sequence? Correct sequence that you will pass and adopt a new idea. First awareness लाना पड़ेगा. Next interest लाना पड़ेगा. बाद में evaluation करना, trial करना, adoption हो जाएगा. That is how the idea is taken into the people, is what you need to remember. What is the maximum permeable ionizing radiation? It is 5 rats. 5 rats, the number you need to remember. Neonatal tetanus, You call it as elimination. Whenever you achieve how many cases per 1000 births, doctor? Less than 0.1 per 1000 births. The moment you achieve that kind of a statistical value, then you have eliminated the neonatal tetanus is what you have to remember. I am very happy to see 50 online students. That is the comfort of online classes. Live classes में थोड़ा delay हो गया तो गड़बड़ हो जाएगा. थोड़ा online class बोले तो you can watch IPL match. Then class start हो गया बोले तो you can shut it down and then you can start this IPL match, right? So don't forget, I will play a IPL match every Sunday. You take a test 9 to 12 first innings and second innings I will play by discussing at least 200 out of 300 questions, and end of every IPL match on every Sunday you should get ready, strengthened to face the World Cup called NEETPG by the time you go in January 2020. Now doc, yes. So what are the radiological features that you see in scurvy? One of the favorite question, doctor. So you should see ground glass appearance, rarefied zone of metaphysis, subperiosteal hemorrhage. This is a very important slide, doctor. In scurvy, you have a subperiosteal hemorrhage, a scorbutic zone called Trummerfield's zone, a dense zone of provisional calcification called as white zone of Frankel, and there is a ring epiphysis which is called Wimberger's sign, and there is something called Pelken's spar. So these are the important features is what you need to remember. Satish is asking, sir, when will be AIIMS discussion? Acha, aaj AIIMS hua kya? Today AIIMS exam, today or last week? If the AIIMS is over, I will try to find out from some of our students the recalled questions. Oh, aaj hua kya? Badhiya, badhiya. No problem. If you have recalled question, WhatsApp us to the helpline. I'll also ask our helpline to talk to many other students in the network who took the AIIMS exam to send some recall questions. Definitely, हम ले लेंगे AIIMS MCQs को और एक लगातार शानदार डिस्कशन करेंगे. Definitely, definitely, no worries. Now, the IV fluids, which is the best for treating a severe case of cholera. Severe case of cholera. Ringer lactate any given day is the best one. So please don't forget, I am giving you the WhatsApp number 9000868356. So please send, if you have taken the exam, the recalled questions to this WhatsApp, to this number. Even handwritten notes you can take a click and then send, and we will process that and come up with the paper discussion, right? Good. On Wednesday, I am there in Visakhapatnam to Vizag to deliver an interactive session. So any of you are from Vizag or Kakinada or Rajamandri or Srikakulam, take an opportunity, we will meet up. So in our face-to-face class where I am there in Visakhapatnam on Wednesday. So on Tuesday evening, if I can get a good number of questions recalled, I will try to conduct Tuesday evening session, Chai Pe Charcha, 6 to 8 hota na, Rose. So in that session, I will try to discuss the AIIMS questions day after tomorrow, if I get the questions, right? Yeah. Now doc, acute flaccid paralysis. There is a AFP surveillance program to detect poliomyelitis. So Guillain-Barré transverse myelitis, IM injection के वजह से भी There can be development of paralysis. So they're all basically included under the AFP surveillance. Now, obesity. What are all the syndromes which are associated? Cushing, Froelich, Lawrence Moon Bardet Biedl syndrome, they're all being included. Preterm baby, 28 weeks gestation, what are all the risk factors that she will be carrying? PDA, respiratory distress syndrome, apnea of prematurity, all these are the important risks that the child will be carrying. Acute infective endocarditis, what are the most common organism responsible whenever the patient is having an underlying heart disease? Staphylococcus aureus is the organism which is typically responsible. Now, neonatal hypoglycemia, what are the predisposing factors for it? You should remember small for date, large for date, erythroblastosis fetalis, birth asphyxia, they are all the clinical settings that predispose to neonatal hypoglycemia is what you need to remember. Now, yes, with regard to the fifth disease, it is caused by parvovirus B19, slapped cheek appearance, arthritis is a most common complication. They are all the true statements. What is the most common congenital metabolic disorder where you have convulsions, cataract and mental retardation? Undoubtedly it is galactosemia. Even on phone call based on this clinical vignette, you should be in a position to answer. Normocytic normochromic anemia, where do you see? We see it in aplastic anemia, chronic kidney loss, kidney disease or any chronic infections like leprosy, tuberculosis, etc. But chronic blood loss lead to iron deficiency and that lead to microcytic hypochromic anemia is what you need to remember. Regarding riboflavin deficiency, what do you see? We see glossitis, nasolabial dysabasia, circumcorneal neovascularization, etc., etc. Multiple fractures of the bone with blue sclera. Where do you see? Typically in osteogenesis imperfecta. If there is a severe obstructive uropathy in the infant, what is the underlying cause? It is the posterior urethral valves which are the most common cause, especially male child with UTI in pediatrics. You have to be careful. Male child with UTI, you have to be very careful. It is the posterior urethral valves. Penicillin, if you are using for antimicrobial prophylaxis, what are all the conditions? Diphtheria, rheumatic fever, asplenia, etc., etc. Right ventricular hypertrophy is not a feature of tricuspid atresia. Tricuspid atresia mein blood is not flowing from right atrium to right ventricle. If the blood itself is not coming to right ventricle, why should right ventricular hyperplasia should be there? It should not be there. Whereas tetology of fallow, pulmonary hypertension with PDA or ostium secundum, in all this there is a volume overload into the right ventricle and hence there is a right ventricular hypertrophy. Severe bronchiolitis, if it is there, how do you want to treat it? Ribavirin is a very good drug. For menorrhagia, we typically use levonorgestrel containing device to manage the menorrhagia. It is the LH surge which lead to the onset of the ovulation. 16-year-old girl sexually active, the best option of the contraception will be combined monophasic oral pill and a condom is the best way. Only progestogen contraceptive. Only progestogen. They prevent benign breast disease. There are many extra contraceptive advantages of the contraceptives, as all of you know very well. So they prevent benign breast disease. They act by inhibiting the ovulation and making the cervical mucus thick. That's how progesterone only pills act. And also they have a role to prevent the pelvic inflammatory disease. That is another advantage which you need to remember. For the laparoscopic sterilization, what are the contraindications? Hiatus hernia, a uterus size more than 12 weeks, previous LSCS scar, they are all considered to be contraindications for the laparoscopic sterilization is what I want to underscore. Mid-trimester abortion. Typically, what is the safest method? Dilatation and suction. Evacuation is the best way for the mid-trimester abortion. Once more, what are the various methods of abortion permitted in first trimester and second trimester? You have to be 100% sure. Very good to see Bharanidharan, Danish, and 53 online students. बहुत बढ़िया. So अभी AIIMS exam खत्म हो गया. So इसलिए from next week I expect 200 of you to join the test discussion, right? So tell your friends. Discussion is absolutely free, but I still advise you to subscribe to our online test so that you take a test like a test and participate in the discussion in the afternoon, sitting in the comfort of your home, stretching your legs on the YouTube. Wow, what a great advantage. So every time end of the class you mark, these are the 5 topics, 10 topics, 6 topics I want to read. So after the test discussion is over, have a nice nap, get up, play a bit of cricket, sweat yourself, then go to the reading room. 3-4 घंटे पढ़ो शाम, हर एक रविवार के शाम 3-4 घंटे रीडिंग रूम में बैठ के पढ़ो. On those 5-6 topics, take the video library. I'll give you the link of the Vimeo video library, and those 6 topics you review there, and then also read in your book, make a quick notes, explain few concepts to your classmates in the reading room. Done. You are ready for the next week. So like that, every Sunday if you can finish about 10 topics, next 40 Sundays आप तो तलवार के धार के जैसे बन जाएगा एग्जामिनर के साथ जंग में लड़ने के लिए, right? So that is very important, doc. Now, mifepristone, what is its function? It is anti-progesterone is what you have to remember. 25-year-old infertility, menorrhagia, last 2 years, ultrasound shows submucous fibroid. So what is the management of choice? Hysteroscopic myomectomy is considered to be the management of choice under the laparoscopic control. Now, how do you know the healthcare facility utilization rate? What is the parameter? It is the bed turnover ratio. कितने admissions हो रहा है? Bed turnover ratio is an important indication. What is meant by selective screening? It is the only high risk group को identify करके उसको screen करने को selective screening कहते. Specificity of the screening typically reflects what? True negative sensitivity is true positives. All of you know very well. Similarly, the formulas for the positive predictive accuracy, negative predictive accuracy, and all that epidemiology questions, doctor. So it is all there in the video library. Please do have a good revision. Revised National Tuberculosis Program. उसमें क्या करते हैं आप? You involve NGOs, You supervise sub-district level, short course chemotherapy is being provided free of charge like our YouTube classes, right? No active case finding done. Active case finding is not the part of RNTCP. Now, if the size of the random sample is increased, what do you expect? The standard error of the mean decrease. For that, you should know how to calculate standard error of the mean. It is square root of the population is in the denominator. So, more the population, the decrease, there will be a decrease of standard error of the mean is what you need to understand. Now, the most important significance test when you are trying to know the strength of association between variables, which one is it? It is the chi-square test, which is a important indicator. Once more, what are discrete variables, what are continuous variables, which is the best test of significance? If it is a discrete versus continuous variable, all those funda you should revise. If correlation coefficient is plus 0.8, plus means positive correlation, 0.8 is closer to 1. So, very strong association is what you can be able to infer. Age adjusted death rates, where do you use them? Why do you use them? Typically, if you take two population, Japanese population, very old people. If you are 80, they say, hey, this man is very young man, they say. And India like place, 40, oh 40, aap uncle hai bhai. Huh? Then by about 60, aap grandpa hai bhai. Whereas Japan, 80, oh this man is little, at right time he married, they will say. So that is the reason age structure of populations differ. In order to mitigate that difference, we use the age adjusted death rates to compare the mortality between two populations. What is the most essential fatty acid that serves as a basis for production of other essential fatty acids in the body? It is the linoleic acid is what you need to remember. A 2-year-old healthy child suddenly develops breathlessness while playing. What is the most likely possibility? With a foreign body aspiration, which lead to such a kind of a sudden catastrophe. Especially, doctor, you have to be very careful with the children until they are 3, 4, very risky time. That is the time where you will produce the first child when you are in MD, first year. By the time you are in your DM second year, your child is playing in the home, but be very careful. Give a call and find out, is your sweetheart is playing well or not? While you are doing 2D echo in the hospital, otherwise you get a call from the home with a panic that the child has swallowed your Littmann stethoscope's earplugs. So that is a big risk, right? So, what is the term for the babies which are born? Rajan Kumar is asking, why not asthma? Let's go back. 2-year suddenly develops breathlessness while playing. Asthma वैसा नहीं रहता doctor. So, small for dead babies is the name given. There is 5,000 population, crude birth rate is 25 per 1,000 means 5,000 में 125 are born. So that is the reason you should be ready for, we give 1 BCG vaccine now, so 125 BCG vaccines you should be ready. IV gamma globulin, which is not an indication. We give IV gamma globulin, Kawasaki disease, ITP, SLE. In all this we give the IV gamma globulin, right? Next, congenital hypertrophic pyloric stenosis में You get a non-bilious vomiting, not a bilious vomiting. So be very, very sure on this. Favorite question. Otherwise, CHPS presents at 3 to 4 weeks. Baby is very hungry after vomiting. It is the firstborn male child is the one who get affected. Thalassemia major, how do you basically treat? We need to give repeated blood transfusions, and to manage the iron overload, you need to give desferoxamine, which is considered to be the clinical management. In tricuspid regurgitation, that lead to ultimately right ventricular failure. So you have systolic pulsations of the liver, and the prominent V wave in the JVP are the classical features of tricuspid regurgitation is what you need to remember. Very good. Venkat Nikhil is saying even erythromycin like macrolides also can cause CHPS. Dekho, that is a favorite question of the examiner, right? So some of you are mini professors, doctor. Please remember, mini professors हैं आप. जब आप पढ़ रहे हैं ना, अकेले मत पढ़ो. Revision के लिए barber learns the trade on an orphan's chin. तो एक ऑर्फन मिलेगा आपको रीडिंग रूम में जिसके पास पैसे नहीं है कोचिंग सेंटर्स को जाने के लिए, मगर वो आके बोलेगा कि अन्ना जरा तू बहुत अच्छा पढ़ते ना, मुझे भी पढ़ाओ ना. तो उसको पढ़ाओ, उसके साथ पढ़ो, उसके साथ व्हाइट पेपर कलम लेके रिवीजन करो, उनको भी टॉपर बनाओ, तुम भी टॉपर बनो. So that should be your spirit whenever you prepare for the exam. That's good. That's good. So we have Professor Venkat Nikhil in our audience. Very good. So Nikhil, please do come every Sunday as a Professor Emeritus and contribute some good points. That's very important. That's a good habit actually. As we keep, the discussion keep going, no? Keep punching some nice point that you remember. Fat, keep punching. The chat window should keep running, right? So then you are making use of this interactive session, doctor. Be very sure, right? Good to see 56 online. At least 70 we should touch. Call your classmates. Now, doc, which is not correct statement about pregnancy. There is an increased frequency during of micturition. True. Hemoglobin levels becomes lower than pre-pregnant because of anemia. Then blood volume increases. Pregnancy is a state of hemodilution. But if you look at free bilirubin in pregnant women compared to non-pregnant women, it is lower. That is what you need to remember. Now, a patient has active TB diagnosed during the 6th month of pregnancy. What is the combination of drugs that you want to give? INH, rifampicin, pyrazinamide is the typical combination. Acute fatty liver of pregnancy. How do you make a diagnosis? Liver biopsy is gold standard, but with a bleeding diathesis in acute fatty liver, it is not practical to put a needle and do that. So biochemical investigation is best. So how do you describe acute fatty liver of pregnancy, doc? Microvesicular fatty infiltration of the hepatocytes. Very unique for the human pregnancy. If you happen to do a early diagnosis and clinically manage, you can decrease the mortality dramatically, is what you need to remember. Now, acute fatty liver of pregnancy, HELLP syndrome, TTP and DIC you have to differentiate. Typically in acute fatty liver of pregnancy, the prothrombin time is significantly elevated, LFT significantly elevated, platelet count is decreased. So this laboratory investigation is very, very important, right? Once more, cholestasis of pregnancy versus fatty liver of pregnancy. versus HELLP syndrome and PUP. PUP is pruritic urticarial papules of pregnancy. PUP, which will have recurrence, which will appear in third trimester, which will appear from first trimester onwards. All these things you have to be 100% sure, doctor. We have had a discussion of all this made available in the video library. So please be sure to subscribe to our video library and do the revision. Very good. Professor Venkat says ethambutol is contraindicated because it leads to color blindness. Absolutely, and children cannot tell about their color blindness that easily. Now, pregnancy mein which antihypertensive is contraindicated, doctor? Always ACE inhibitors. No in pregnancy. A pregnant with mitral stenosis at 38 weeks come to the antenatal clinic. What do you want to do? You have to admit the patient and closely monitor her heart. All stenotic valvular heart disorders worsen in pregnancy. All regurgitant valvular heart disease improve in pregnancy is what you have to emphatically remember. RH negative mother. How do you want to manage? You can't give prophylactic methergin and create a tumultuous uterus leading to uteroplacental hemorrhage, which is not good and detrimental for a RH negative mother. Now, with regard to the labor, so normal and abnormal labor is such an important topic, doc, you have to be very sure. So the dilatation of the cervix occurs at a rate of 1 centimeter per hour in an active stage of labor. Up to 3 centimeters dilatation, you call it as a latent phase. And you all know there are 4 stages of labor, and the partogram is the best way to manage the labor. 18-year-old girl, not attained menarche, with acute retention of urine. What is the most likely diagnosis? Hematocolpos. Hematocolpos because of a imperforate hymen. So that is a typical classical presentation. Now, congenital adrenal hyperplasia most commonly is because of 21 alpha hydroxylase deficiency. Once more, 21 versus 17 versus 11, which is salt losing, which is hypertensive. Different types of congenital adrenal hyperplasia. You have a full discussion available in the video library, doctor. Please subscribe and do a quick review, very important. Which is that cyst that arise from the mesonephric duct and lies in the anterolateral aspect of the vaginal wall is an important question. It is a classical description of Gardner's duct cyst. So where is this located, doctor? It is located in the anterolateral aspect of the vaginal wall. You can see this is the vagina, this is the bladder, and the anterolateral aspect of it, you are having the Gardner's duct is what you need to classically remember. Mayer-Rokitansky-Kuster-Hostner syndrome of the Mullerian agenesis. Phenotype is female and the genotype is 46XX. They are very much female, but only problem is the development of the Mullerian system is Mayer-Rokitansky. Big baby, why is she born to a diabetic mother? Because hyperglycemia. Hyperglycemia stimulates hyperinsulinemia in the fetus, and insulin always will be responsible for a big baby is what you need to remember. Where is breech presentation very common? What are the predisposing factors? Bicornumate, unicornumate, septate uterus, all this predispose to breech because of a decrease in the space inside the uterus. Soft tissue sarcoma, what are the risk factors that lead to a distant metastasis? The deeper it is, the higher the grade, the recurrent presentation, they are all the important risk factors for distant metastasis. Soft tissue sarcomas. Classically, lymphedema is a predisposing factor. Prior irradiation is one of the important causative agent, and 50% of them they occur in the extremities is what you need to remember. So what is the poor prognostic factor in extremity soft tissue sarcoma? High grade histology. High grade histology always is associated with a very high risk is what you need to remember. Right? Now, very good. Once more, Professor Nikhil fires a good missile. What are safe in pregnancy? That is very important. Yes. So, cardioselective beta blockers, alpha-methyl dopa, clonidine and prazosin. Absolutely right. Clonidine is arcamine tablet. Very cheap. Very safe in pregnancy. Certainly, methyl dopa, all of you know, is quite safe, and prazosin. So, these are the important drugs. Absolutely, doc. Biopsy of which primary bone tumor? Biopsy of a primary bone tumor, when do you want to do? You have to do after a thorough staging is completed. Staging first, grading next. That is the rule with the bone tumors. Which bone tumor, the radiological appearance is good enough that you do not require biopsy? Osteochondroma. You can see the osteochondroma typical appearance like this. For this, the radiological feature is sufficient and there is no need for biopsy is what you need to remember. So, how do you treat an impending fracture? It is the internal fixation which is the best method. For osteogenic sarcoma, preoperatively we give chemotherapy. So, preoperative chemotherapy, how good you could initiate, how early you could initiate is an important predictor of the disease-free survival is what you need to remember. Now, let us go back to the basic sciences and take up few questions. Chord tympani is a part of 7th cranial nerve. So, it joins with the lingual nerve, it supplies anterior 2/3 of the tongue, and it is not sensory supply. Sensory supply is by the trigeminal to the face. Only the angle of the mandible area, the skin overlying, is the only area not supplied by trigeminal, and that is supplied by great auricular nerve is what you need to remember. Similarly, all muscles of the face are supplied by the facial nerve except levator palpebrae superioris, which is supplied by oculomotor nerve. They are the two exceptions that you need to basically remember. Now, doc, chord tympani, it carries the taste fibers for the anterior 2/3 of the tongue, and it also carries efferent preganglionic parasympathetic fibers destined to reach the submandibular ganglion in the floor of the mouth is what you need to remember. All this they drain into the internal jugular vein, superthyroid vein, lingual vein, facial vein, etc., etc. Now, you should be very sure what are the divisions of the facial vein. Anterior division, typically it forms common facial vein that drains into internal jugular. Whereas posterior division, you can remember OP lift, outpatient lift, occipital vein, pharyngeal vein, lingual vein, inferior petrosal sinus, facial vein, superior and middle thyroid veins. That is how the drainage occurs is what you need to understand. Very good. Giant cell tumor osteoclastoma, right. The soap bubble appearance, epiphyseal, eccentric, expansile, expanding. Like a parrot, you should rattle out this story. Good. Medial wall of the orbit. What is it formed? It is formed by ethmoid bone, lacrimal bone, frontal process of the maxilla, and orbital plate of ethmoid, body of sphenoid, etc., etc. Whereas the lateral wall of the orbit is the strongest wall. It is formed by two bones, zygomatic and orbital surface of the greater wing of sphenoid is what you need to remember. When is the differentiation of the gonads in human fetus? Male as male, female as female. By what time is it decided? 9 weeks it takes before that decision is being taken. Now, perineal body, which muscle is attached, doc? Bulbous spongiosus is the one which is attached to the perineal body, and yes, for the vagal tone, what are the important predictors? Obviously, the higher the vagal tone, the lower will be the basal heart rate. That's the reason it is a very important predictor. About withdrawal reflexes, the withdrawal reflexes are polysynaptic, they have a long latency and they have a after discharge. They're all the true statements is what you need to remember. Now, with regard to the cerebrospinal fluid, maximum amount of the cerebrospinal fluid is produced by the choroid plexus. Now, doc, with regard to the ECG, what is the true statement? So, whenever the PR interval is more than 0.2 seconds, every small box is equal to 0.04 seconds. One large box may, how many small boxes? 5. So, one large box is equal to 0.04 into 5, that means 0.2 seconds. So, the PR interval, the start of the P wave to the start of the QRS, if you happen to calculate, it should not be more than one large box is an important rule which you need to basically remember. Testis is an important source for androstenedione, testosterone, and dehydroepiandrosterone is what you need to remember. Whereas dihydrotestosterone is only a metabolite of the testosterone. So with that, we will call it a day, doctor. And I wish you all a wonderful Sunday, an enjoyable evening. And once more tomorrow evening 6 to 8, we continue our medicine discussion. And for another 3 weeks, we will only discuss last 15 years All India question bank, Monday to Saturday. Only Wednesday, Thursday, I travel to different parts of the country to conduct a interactive pep talk session with the students everywhere, final years and house surgeons. So this week I am there in Visakhapatnam. So even a teacher like me has to advertise that I am the best for you and ask the students to consume the teacher and the video libraries that we built and the mock tests that we have created, and ask them to become our subscribers. So doctor, those who did not subscribe to our video library, please do call our helpline, and they give you the best discount to join the mock tests and the video library access. Thank you all for a patient listening.